This topic is nutrition for the newborn. Adequate nutrition is required for the newborn's rapid physical and neurological growth and development. Breastfeeding or formula is a newborn's primary nutrition source until they are 1 year old. When the child turns one, whole cow's milk can be provided. The fat content in whole milk is important because it is necessary for a child's brain development. Newborns require 8 to 12 feedings a day. That's about every 2 to 3 hours. And each feeding is approximately up to 20 minutes. The newborn will give cues when it is finished, like detaching from the breast or falling asleep. 6 months of breastfeeding exclusively is recommended. Breast milk offers the newborn the nutrition needed for proper development and growth, and it aids with the newborn's immunity because it contains antibodies. At about 6 months, the child will be introduced to solid foods, but breastfeeding may continue for 2 or more years combined with the solids. Fluid requirements for the newborn are 140 to 160 milliliters per kilogram per day. Let's talk about the macronutrients and micronutrients as they pertain to newborns. While fats are the most important part of breast milk, fats, carbohydrates, and proteins are all macronutrients present in breast milk. Fats and carbohydrates are essential for central nervous system development, involving the brain and myelination of nerves and spinal cord. Fats also help with vitamin absorption and hormone production. And the fat content of breast milk is affected by the maternal diet and gestational weight gain. Proteins. Breast milk contains whey protein, which is easier to digest for the newborn. Proteins help with growth and development and provide support to the immune system. Micronutrients for the newborn. Vitamin D supplementation is recommended for breastfed newborns because breast milk has a naturally lower content of vitamin D. The newborn will be given a vitamin K injection after birth because the newborn will not have enough vitamin K synthesis to prevent bleeding until a couple days after delivery. Vitamin B12 supplementation is necessary if the mother follows a strict vegetarian diet because their breast milk is often deficient in vitamin B, which is necessary for neurological development in the newborn, so the mother should speak to their provider about taking a supplement. Benefits of breast milk. Increased immunity due to immunoglobulin in breast milk, providing passive immunity, and breast milk is antiviral and antibacterial. Hypoallergenic, so there is less risk for an allergy or intolerance to develop. And it is easy to digest for the newborn. Decreased infant infections like otitis media, upper respiratory infections, and gastrointestinal infections, and decreased childhood chronic illness like asthma and diabetes mellitus. Breastfeeding reduces risks for postpartum maternal complications, like postpartum bleeding, because with breastfeeding, uterus involution, or the uterus returning to its pre-pregnancy size, happens more quickly. Breastfeeding causes the maternal body to release oxytocin that stimulates the uterus to contract. Breastfeeding increases maternal self-image and may help with stress reduction, with the release of prolactin and oxytocin, increasing feelings of well-being, and increased maternal-infant bonding that direct skin-to-skin contact. Influencing factors. Milk production is stimulated by placenta delivery and breast stimulation. Prolactin is released throughout pregnancy. It signals to the maternal body to make and secrete milk after birth. During pregnancy, it is involved with the creation and secretion of colostrum. After delivery, the prolactin then stimulates the transition from colostrum to milk. Oxytocin is released in response to the action of the newborn sucking. It allows the milk to be ejected from the breast tissue to the nipple. Both prolactin and oxytocin continue to produce milk as long as stimulation from the newborn's sucking continues. For women who choose to not breastfeed, the stimulus is not present and milk production will discontinue over a short period of time. Contraindications: active infections due to the risk of transmission to the newborn, like tuberculosis, if they have TB mastitis with lesions, active herpes lesions on the breast, an HIV infection if they are not being treated and their viral load is not suppressed, because it can be transmitted via breast milk. Medications and recreational drugs. Certain prescription medications like chemotherapy may be passed through breast milk. The use of recreational drugs or alcohol may potentially expose the infant to these substances and possibly cause complications. Some barriers to breastfeeding may include the birth experience. This may influence a mother's want or ability to breastfeed. If there was an emergency cesarean birth due to fetal or maternal complications, the mother may be too exhausted from prolonged labor. And there may have been maternal complications like postpartum hemorrhage, in which the mother needed additional medications or emergency surgery. Other barriers exist for some clients that are specific to that client. Some mothers with diabetes mellitus may think that they cannot breastfeed, but that is untrue. In fact, breastfeeding will benefit the mother and newborn. For the mother, breastfeeding can help with blood glucose regulation. The mother will just have to monitor blood glucose levels more frequently. Any previous breast surgery. This may affect the breast so that breastfeeding is not possible. Surgeries may cause nerve damage and loss of sensation, and surgery may damage milk ducts. PCOS, or polycystic ovary syndrome. This is a hormonal disorder that may cause inadequate milk production. Obesity. Some maternal clients who are obese may not be able to produce a sufficient amount of breast milk, and latching on may be challenging for the newborn. Stress. The mother has a newborn to take care of, maybe additional children at home, and just the stress of life may impact breastfeeding. And admission to the intensive care unit following birth of either the mother or the newborn. Stages of breast milk. Colostrum is the first milk produced, and it is the first milk available to the newborn after delivery. It is thick and creamy and yellow in color. It is produced in small amounts, so it helps the newborn to learn to nurse frequently, and this in turn helps encourage milk production in the mother. It contains vitamins, minerals, proteins, carbohydrates, antioxidants, immunoglobulins, and low amounts of fat. Colostrum promotes development of the gut microbiome, and this will protect the newborn from illness. It reduces the risk of hyperbilirubinemia because it stimulates meconium passage. Stages of breast milk. The letdown reflex, or milk ejection reflex. With nipple stimulation, the hypothalamus causes the posterior pituitary gland to release oxytocin, which causes the breast tissue to contract, pushing milk and fat globules into the ducts. This normally happens within 2 minutes of the infant sucking. The letdown reflex can also be stimulated by the sound of an infant crying. Colostrum is the first type of breast milk available to the newborn. Then it becomes transitional milk. This happens at about 2 to 3 days after delivery. This is produced in large amounts. This is yellow and looks very similar to colostrum, but it is higher in fat and calorie content. Mature milk is produced by 2 weeks postpartum. It is white or blue tinged in color, and it is thinner due to a higher water content. A feeding for a newborn begins with foremilk. This is present at the start of feeding. It has a watery consistency and it is high in protein and lactose, but low in fat content. Hind milk is the milk that presents during letdown, and that is high in fat and calories. Formula is made from plant and bovine sources. It can be from cow's milk or can be soy based. There are also specialty ones for infants with allergies. Formula provides newborn nutrition when breastfeeding is not an option. Some mothers are unable to breastfeed, whether there is a contraindication or there are other obstacles. Formula is low in iron and should be iron fortified. Premature infants require supplementation due to lack of iron absorption. Formula feeding allows for more partner involvement. Now, someone else other than the mother can feed the newborn. There is increased risk for overfeeding. Sometimes the caregiver may expect the newborn to finish all of the formula in the bottle, each feeding, and that doesn't always have to happen. Increased expenses. Different formulas cost different amounts, with specialty and hypoallergenic ones being more expensive. And the additives in formula may result in intolerances. An example would be that some are made with cow milk protein, which results in an allergy to that protein. There is no immunological benefits, and it has been linked to more respiratory infections and increased gastrointestinal infections because it affects the gut microbiome differently than breast milk. Nursing considerations. Promote partner involvement in the feedings. The partner can assist with positioning the newborn, they can provide encouragement to the mother, and they can burp the infant after feedings. With formula feeding, they can even do the feeding. Support the mother's choice in the method of feeding. We want to provide the mother with all of the information available so that she can make an informed decision, and then we will support that decision. We want to review maternal prescriptions for lactation safety. The mother should alert all healthcare providers that they are currently breastfeeding so that the safety of a medication while breastfeeding can be discussed. The mother should also alert the newborn's healthcare provider of any medications that they are taking during breastfeeding. Weight assessment. Up to a 10% loss of weight is expected after birth in the newborn, but it is normally regained in 1 to 2 weeks, so the newborn should be back to their birth weight by 2 weeks after delivery. This initial weight loss may cause worry for some new caregivers, so explain that it is expected. Avoid encouraging pacifier use in breastfed newborns until weeks 3 or 4. For breastfed newborns, you want to have breastfeeding well established prior to offering a pacifier to the newborn, whereas a newborn-fed formula can be offered a pacifier at any time. Nursing considerations. Newborns are more at risk for dehydration because their kidney function is still developing and due to their body composition. Newborns with fever, vomiting, or diarrhea are at an even more increased risk for rapid dehydration. During this time, the newborn will have increased nutrition requirements. We want the caregivers to report signs of dehydration immediately. These include crying without producing tears, decreased number of wet diapers, and urine that is dark or concentrated, and hard, dry stool. Dry, pale mucous membranes, poor skin turgor and dry skin, sunken or depressed fontanelles, and tachycardia.